Hi, I'm Rance,
And I'm Brittany Black.
and we're graduate students at the University of Central Oklahoma in the LMFT program.
And today we're going to be discussing cognitive behavioral therapy for sexual behavior problems in children and adolescents. The first thing we're going to do is an overview of what sexual behavior problems are and what they are not. There are certain problems in children that are actually normal. We can expect them to do these things. And there are issues that are not normal and we should be concerned. Issues that are normal is immodesty in children, wanting to be naked, in younger children. Also matters of being curious about body differences, curious about body parts. Also with older children, it is normal for them to be interested in sexual media content. It is also normative for them to be interested in the opposite sex to a certain degree. Issues that are not so normal is things that are clearly beyond the child's developmental stage. If they do things that they should know better than by the age of their mature development. Anything that involves threat or force or shows aggression, that is also things to be concerned with and to send a red alert. Common misconceptions versus findings of sexual behavior problems. One misconception is that all child sexual behavior is normal. This isn't true because some sexual behavior definitely is not okay. Another misconception is sexual acts between children is not harmful. This isn't true, as sexual acts between children can be significantly harmful. When there's aggression or when children are highly reactive to things going on, that's a clue that the sexual act between the children is indeed harmful. Children's sexual behavioral problems means childhood history of sexual abuse. Not necessarily. Many children with sexual behavior problems haven't been sexually abused. Sexually abused children will have sexual behavioral problems. Most sexually abused children actually don't have sexual behavioral problems. That's a misconception. Sexual behavioral problems are primarily boy problems and rarely girls. This also isn't true because many females have sexual behavior problems. Children with sexual behavior problems shouldn't live with other children in the home. This isn't necessarily true. With assistance, it's been found that most children with sexual behavioral problems can live safely with others. Another misconception is that children with sexual behavior problems should be definitely institutionalized. The findings have found outpatient treatment can be successful. Children with sexual behavioral problems shouldn't attend public school. This also isn't true, as it's been found that most children with sexual behavioral problems can safely attend public schools. Children with sexual behavioral problems will continue with sexual behavior problems without long, intense therapy. Not true. The findings have found sexual behavior problems rarely continue in children after short-term treatment. And lastly, a misconception is that children with sexual behavioral problems become sex offenders. This is just completely false. The findings have found future sexual behavioral problems by children appears to be low.
In targeting sexual behavior problems, professionals have developed a continuum. In this continuum, it gives an example of common sexual problems, such as sexual play, that's not necessarily viewed in a negative way, and problematic sexual behaviors. These are things that Brittany just previously shared that you have to pay attention to and look at, and also recognition is critical. Behaviors and tendencies that you can see are impulsiveness and a tendency to act out before thinking, difficulties following rules and listening to authority figures in the home, in school, or in other areas where you may be in public. The children may also have problems making friends with children that are younger than them. And then a limited ability to self-soothe. They may touch themselves to find some form of comfort, and this is not necessarily something that you'd like to promote. This is a problematic sexual behavior. the thing is, for parents, there's a common parental responses that we often see, such as difficulty believing the sexual behavior occurred, having some anger, blaming the child, blaming themselves, developing negative feelings toward the child, or withdrawing from their own child because they're not sure how to handle this situation. You may also see guilt or remorse, shaming, and a sense of feeling alone or isolated. You may think that this only happens to me. Why is this happening to me? And which can cause confusion and uncertainty. These are common parental responses that you don't need to feel like you are the only one, because you're not the only one. These behaviors are out there.
So the most important thing to do when we find out that our child actually does have a sexual behavioral problem is to remain calm. We need to decide and assess the situation and judge what is the best plan of action next. Also, we need to make sure we call Child Protective Services if that is accurate, if that's something that we need to do. We need to assess if our child is safe. We need to make sure that the victim is safe. We also need to make sure that the children are better supervised in the future. When we talk to our children, we also need to make sure that we listen to them and what they're saying and that we understand them. We need to ask open-ended questions, things like, well, what were you doing? Or how did you feel when you were doing such and such? That way we can understand how the problem happened. We can also ask questions such as, what gave you the idea to do such a thing? So we can understand where they may have developed the sexual behavior problem or what was at the root issue. As far as when we talk to children, we need to make sure that we're talking to them in developmentally appropriate ways. Boys and girls under the age of 4 have certain things that they might be curious about that we can relieve by giving very minimal information, such as boys and girls are different and leaving it at that. Also saying things like babies come from mothers, or giving them simple answers to their questions. Age-appropriate information for children that are older than 4 but under 6 might be things like bodies tend to change, simple explanations for pregnancy and birth, also things like body and body functioning, touching yourself in private and making sure you're doing things like that. Just things that are minimalistic, but a little bit more information, giving explanations for how they should behave in public and also what is appropriate to do alone. Appropriate information for children over 7 to 12 would be puberty expectations, because they are coming in that time frame. Also basics about reproduction, a little bit more logistics about what happens with pregnancy and about how birth goes. STIs and risks for that. Sexual activity risks, also the basics of contraception, and insist on masturbation and privacy.
Cultural views have been linked to sex offenders and pedophiles. With sexual behavior problems not having much information previously, that's what society has put facts on when they hear sexual behavior problems, that it was from pedophiles or sex offenders. So what has been sought after now is to bring evidence that just because a child has sexual behavior problems, that does not mean they have they're a pedophile or a sex offender. So we're trying to educate on cultural views. Some common facts about sexual behavior problems is that it is in both boys and girls. Boys and girls both demonstrate SBP. Research has suggested of a greater prevalence in SBPs in girls in the preschool years and then in boys during the school age years. Some studies have suggested that girls with sexual behavior problems are more likely to have a history of sexual abuse or child abuse than boys. Further factors that contribute to the developmental and maintenance of problem behaviors are similar across all disruptive behavior disorders and sexual behavior problems.
Different things that socially contribute to having sexual behavior problems is trauma in the home. Things like abuse and natural disasters happening or an accident happening. Also exposure to violence in the home, that's another social contributor. Excessive exposure to sex and nudity, especially in the public or in the media, can also have a bad effect on children. bad rules about modesty, just rules that aren't appropriate for adults to allow their children to do. Those things can also lead to children believing that certain sexual behavior is okay, but it's actually a sexual behavior problem. And also inadequate supervision in the home. When there's a parent with substance abuse or a parent that's neglectful of their children, then children are left to behave in ways that might not be appropriate, and they might not have the proper supervision to act differently. As far as the rationale for children with sexual behavioral problems, children are more likely to have sexual behavioral problems when they have low parental involvement, when they live in areas of lower socioeconomic status, just due to the things that they might have to overcome in their particular society that they live in. Also, peer groups, peer pressure. They also might end up with sexual behavior problems if they have a mental disorder or if they undergo sexual abuse themselves. Also, inaccurate perceptions of what's going on in social media might cause them to act out sexually.
Research on treatment with children with sexual behavior problems is very new. Children with sexual behavior problems will continue to have these sexual behavior problems without long-term intensive therapy. Most children do not continue to have SBPs, sexual behavior problems, if they do go through with some form of therapy or counseling. Treatment outcome research demonstrates that most children showing significantly lower sexual behavior problems after short-term outpatient treatment often is 12 to 32 weeks. That's usually the duration of sessions and counseling they may have. And then the recidivism rates for children 6 to 12 were approximately 15% to 2 years after treatment, which that means to see the sexual behavior problems reoccur is greatly lower, so it's about 15%, so that's drastically lower than what they currently were. Understanding treatment, adolescents in community-based treatment programs and living in the community are treated in shorter terms, less intensive programs that usually meet once a week for 1 to 2 hours and last from 8 months to 2 years. Some adolescents need long-term intensive treatment and a restricted placement. We will talk about how these sessions can occur later on in our video.
As far as the DSM-5 and sexual behavioral problems in children, very little research has been done to examine this issue. Currently, the DSM-5 really only has sexual disorders for diagnosis. So as far as what children with sexual behavior problems are usually diagnosed with, they're usually diagnosed with some types of mood disorders. There's a list of them. Usually they're in the category of conduct disorders or anxiety disorders or adjustment disorders or personality disorders.
Cognitive behavioral therapy view on sexual behavior problems. Few children provided with cognitive behavioral therapy for sexual behavior problems were found to have any future sexual offenses. Results suggest long-term risk is low after appropriate treatments, and that the behavior is not difficult to modify in most cases. With strong caregiver focus, short-term cognitive behavioral treatments are the treatments for children with sexual behavior problems that have been found most effective. The child cognitive behavioral therapy approach emphasizes learning sexual behavior rules, basic sexual education, self-control, and preventing future abuse. Common treatment packages are group therapy for children and adolescents with sexual behavior problems, behavior modification, principles for group management and emphasis on cognitive rules, decision-making, impulse control, and education. This approach to group treatment of children with sexual behavior problems is highly structured and utilizes a teaching learning module. This allows the children to have a safe zone and a comfort zone where they can be in a session with children that have also had sexual behavior problems and maybe not be viewed as in a negative light with their own peers. Common treatment plan session outlines include 12 sessions specifically for the children and adolescents, objectives for each session, the materials needed, the topics to be covered, suggested content for covering the topics, and questions for the children's weekly assessment. For the parents, this is also great if you can have another group going on at the same time so they can be aware of what their child may be going through, such as what may be in that session's objectives for the day. That way, later on, the parents can be on the same page for what their children may be going through or their adolescent children. 5 major treatment topics is, number 1 is acknowledging the inappropriate sexual behavior. Number 2, learning the sexual behavior rules. 3, improving impulse control. 4, receiving sex education. And 5, preventing re-abuse of self and others.
As far as the research in cognitive behavioral therapy and sexual behavioral problems, the research shows in support of cognitive behavioral therapy for sexual behavioral problems. It shows that there has been a substantial change over the course of treatment with children that do undergo CBT for SPB. The primary result emphasizes that the inclusion of a caregiver is the best outcome for children with sexual behavioral problems to have when there's more parental involvement. Also, the research does show that group treatment does not show necessarily to be more effective than individual or family treatment.
Now we're going to talk about the treatment manual for cognitive behavioral therapy for children and adolescents with sexual behavior problems. Objectives for the treatment manual for the sessions will include introducing the children to each other, clarify with the children the purpose of the group, give an outline of how the group will be conducted, and then establish group responsibilities. The second session there may include some new children, and if that case, you will need to reintroduce the children to each other or adolescents. You will need materials for all 12 sessions. Some of the materials will include name tags, folders for all the children to put all the paperwork or arts or activities that will be done, pillows, that's optional in case they want to sit down or relax, a flip chart and markers, crayons, felt tip pencils, and pens, an attendance sheet because attendance will be something that is very highly recommended because they will need to attend all 12 sessions. Assessment sheets that'll typically be done after every session, but there will be a few sessions where there won't be an assessment sheet, particularly session 1. Things I have talked about and how I can listen chart, a group therapy record, which that's optional, and then a rubber stamp of star and an ink pad. This can be used for activities as well as if they do something good, whether it's opening up to the group, sharing something, or maybe giving a really good example. This can give the children some form of acknowledgement that they were heard and they did something very well.
How the structure of each session will go is each will add more and more to the agenda as the sessions continue, but at first it's going to pretty much just be establishing group responsibilities, and then we're going to add talking and discussion. We're going to practice the talking rules, explain the therapist's responsibility in the group treatment. We're going to teach behavioral rules. We're also going to have a turtle technique game in some of the sessions. We're going to have sexual education go on in some of the other sections. And then as we go on, we'll identify male and female body parts. We're also going to do some abuse prevention education. We're going to go over assessment questions at the end of each session. We're going to have discussion over things I've talked about and how I listen with each child. We're going to have a folder for the material for them to take home. And we're also going to, at the very end, say goodbye to each other, present certificates, and have a final prize basket. For the things I have talked about and how I listen section of each session, it's just pretty much just group discussion. All of the children are going to talk about the content that they've had throughout the class and how they listen to it and what they've heard, and if they have any questions. The questions will all be in the nature of sexual behavioral problems, about their feelings about certain things, the names of body parts if they have any questions about that. Our last meeting with the group, just kind of recapping and reviewing what happened. and what was discussed. And also we'll talk about being a good listener, and we'll talk about a little bit of talking rules. Don't talk while other people are talking, be respectful, and listen. As far as assessment questions, each session is going to have assessment questions at the end of each session. The assessment questions are just to gain an idea of where the children currently are in their education over sexual behavioral problems. And so we'll have a list of questions. An example of a question is asking, is it okay for you to say what's in this group? And they would say yes or no. You're hoping that they say no, because you would hope that they aren't going to spread the information out for everything that everyone said in the group. That's just an exception. That's just an example of the assessment question. The assessment questions will be written down, we'll check them over, and we'll just kind of discuss each one.
During each session, there will be certain things that will be covered. For example, in session 3, we will go over sexual behavior rules. Rule number 1, it's okay to touch your own private parts when you are alone. Rule number 2, it's not okay to touch other people's private parts. Rule number 3, it's not okay for other people to touch your private parts. And rule number 4, it's not okay to show your private parts to other people. In session 5, we'll go over the turtle technique story. We were going to tell a story that gives the children an idea of what is right and what is not right. This also goes so not be impulsive. The purpose of the story is to educate the children that they may have some impulsive behaviors at times and that they need to think about what they're doing before they do it. The turtle technique allows them to go over certain steps in accomplishing this. The first rule is remind the children that the purpose of the group is to help them learn to not break sexual behavior rules. So when we go over the turtle technique, the first thing we want them to do is to stop and wait. Have the children imagine a stop sign and then discuss the children's feelings. We want them to stop and be aware of what they're about to do. The second thing is go in your shell like a turtle. Relax. Stop and think about things. This is where they pull themselves back, get themselves in a safe zone or a safe place where they feel comfortable, and think, what are some consequences that might happen? Which that leads us to the next thing, is think. Tell the children, ask yourself, is what I'm thinking about doing okay? What will happen if I do this? And what could I do instead? And then the following, do something. Explain now that the turtle has picked something to do and he or she needs to go ahead and do it. This is where you educate the children and teach the children that in the adolescence, that once you've come to a conclusion on what you should do, what's appropriate, that you need to take the next step and act on it.
In session 8, we will begin to talk about body parts and naming each thing and how each thing functions. For women, we just kind of talk about 3 things, and for men, we also talk about 3 things. And we have a diagram. The female diagram, as you can see, will show the uterus, the vagina, and the breasts. And we will have each child name each thing. And also, we will discuss each function of each thing, of each body part. The male diagram, as you can see, will show the penis, the scrotum, and the testicles. And we will identify each portion and also have the children name each body part, and also how we will describe the function of each body part. We'll ask the children what the name is for the time that girls begin to change into women and the boys begin to change into men. And we will have the children list the different changes that occur during puberty.
After going through the body parts, that'll lead us to a discussion over sex education. This is where we're going to allow the children to understand that where babies are made, how babies are made. We're going to read the book or have a book there that'll tell the children and the adolescents what they're going through. The book is called Where Did I Come From? You may be in another session or another counselor or educator, they may use a different book, but in our treatment plan, we will use Where Did I Come From? After going through the story, we'll let the children know a few things, such as we will talk about some more body parts and their purposes. You're going to use the names for body parts that doctors use. This will allow the children, if an emergency ever occurs, that they can describe the correct body parts, such as breast, vagina, penis, scrotum. This will allow any adult to know exactly what they're talking about instead of other names such as TT or PP. Not all body parts are the same for boys and girls. This will be an education moment where we can let them know that, hey, you are different. The children need to be aware of this, especially children that have showed some form of sexual behavior problems. That their bodies don't look alike and exactly alike, and that adults right now, but their bodies will change as they get older. This is just to let children know that, hey, who you are now will be changing. It's not what you're going to be stuck with for the rest of your life. As you get older, your body goes through changes. This is for children that may not be going through puberty yet. So this just allows them to understand that bodies change as they get older, which leads us to puberty. The changes that take place during the ages of 9 to 14 is called puberty. We'll provide education on what changes occur, how they are going to occur, and then maybe what you may need to do for when puberty occurs. And then we'll name what body parts change so the children can be aware of and have an expectation of what will be changing. Also in this session, we'll explain about to the children and adolescents about talking about sex. We're going to explain the following. After sex education, that will lead us into another topic that will need to be discussed, which is talking about sex. During this, we're going to explain the following to the children. Ask questions to someone that you know well and you trust. This is a good opportunity to let them know it's okay to ask questions, but they need to ask questions to the proper authority, such as a parent, or maybe in the right situation, a teacher, or maybe they can talk to their counselor or therapist and they can put them in the right direction. Ask questions when the person you are asking is not busy. This is a time to let them know, hey, there's a time and a place for each question, which also leads to find a time to talk when there are not a lot of other people around. We need them to feel safe, and that way they won't feel judged. That way it's highly recommended that it is a parent, because the parent can put them in a safe area where they can feel comfortable and they don't have to worry about people's responses or different looks, because children and adolescents can go a lot off facial features. And then ask, when is it a good time to ask your parents about sex? You don't want to ask too young, you don't want to ask too old. And this is also something that the parents can, if there's another session going on at the same time, about when is the right time to talk to your children about sex. Usually it is better not to ask other children about sex, because many times adults as parents wants to be the ones to talk to their children about sex, rather than having children talk to each other about it. Ask, why might it not be a good idea to ask other children about sex? This gives the child an idea that, hey, there are certain people I should talk to and there are certain people I should not talk to in regards to sex.
As far as prevention guidelines, as they're shown, the prevention guidelines are basically to teach children how to avoid possible abuse of sexual behavior. We need to demonstrate that even adults need a good reason to touch your private parts. Adults can't just touch them just because they are adults. It's okay to say you're going to do it yourself. If you need to take a bath, when you want to take a bath by yourself, you don't want any adult help, it's okay to say that you can do that yourself. Or using medicine. If you have to insert that medicine somewhere, it's okay for you. That's what we would tell the children to know that they can do that themselves. We also need to let them know that it is okay to say no, and to say no if they do not feel comfortable doing something. They need to know that they can yell. If they feel like they're in trouble, then we would encourage them to do that, to yell, to scream until someone hears them and helps them. We would encourage the children to tell someone if something sexually inappropriate happened to them, and never, ever, ever keep secrets. We also encourage them to keep telling someone until someone believes you. Don't ever let it go. The way we close is by each child saying goodbye to each other. We also present certificates and we hand out final prizes for each child. We want them to know that we really appreciate them taking time to listen and to understand sexual behavior. And we also want them to know that they have made strides in the issue and now they are educated and we feel proud of them.